Hey everyone, welcome back to my channel. It's Dr. Alessandro. Thanks for joining me. And today's video is going to be about something a little bit different. It's going to be about where to put denture adhesive in a denture and how much to use. We get asked that question from some denture wearers, and I would imagine that a lot of denture patients might be a little bit confused or may not have been told what to use or how much to use. So we want to give that illustration here and show people how much they should be using, because it might not be the quantity that he or she may be thinking. So without further ado, I'm going to demonstrate it. Now, our practice actually is awaiting a shipment of samples of denture adhesive. So I'm going to be using a few other things to, say, illustrate the quantity of denture adhesive and where to place it. So it's not going to be denture adhesive because I don't have samples, but we will certainly be trying to at least provide a good visual representation. That way you, the patient, understands, hey, this is how much I should use and where it should be put. I'm only going to be using an upper denture, but I can certainly describe in the lower denture where the amount, where the denture adhesive should be placed and the amount that should be used. So, all right, without further ado, we'll get to that. Okay, so here we have our typical upper denture. Now, this is not a person's actual upper denture. This is a model that a laboratory has provided for us to be an illustration for folks trying to understand what a denture is. So I'm going to show you where to place the denture adhesive and roughly how much by using, well, hand lotion, because I do not have, or well, skin lotion overall, but because I do not unfortunately have any kind of samples of denture adhesive. So here we go. First spot should be right here. And that's about how much to use. In fact, that might be a little bit generous. So look at that and maybe cut it by a very slight amount. And now the second spot should be back here in this area. So that's the front of the denture. The second spot should be back here. And yeah, that's more like it. Okay, so now you can kind of see, you know, the front one is a little bit big. The second one towards the back, much better. And now you can see, here comes the third. So there you have it. That's pretty much how much denture adhesive to use. So, in fact, like I said, the front one, the front dab that I use might be even slightly too generous. So, here is what you got. Now, I'll demonstrate what not to do in a few moments. So, hang tight and I'll show you what you shouldn't be doing when you're applying denture adhesive. Okay, so now I'm going to demonstrate to everybody what not to do and how not to place denture adhesive. So, ladies and gentlemen, denture adhesive is not like barbecue sauce. You're not going to town like a barbecue, okay? So, what we don't want to see when we have a denture coming in is this old wad, everything covered in adhesive. Okay, so if you cover everything and make a nice thick goopy layer, all right, that's too much. So using denture adhesive is not like slathering barbecue sauce all over things, okay? This is way too much. It gunks up the denture. It also probably means your denture doesn't have much adhesion. It's just not retentive onto the palate or wherever. So this is not the way to do denture adhesive. So just as an illustration, do not treat your denture adhesive like it's barbecue sauce on a burger. All right, so thanks again for joining me on this video on where to put denture adhesive on a denture and how much to use. Again, use a tiny dab in those 3 spots that I indicated, one in the front and one on each side in the back. That applies both for the upper denture and in the horseshoe-shaped lower denture, same spots. You'll know where to place them. Again, if you're using that much denture adhesive that you're coating the entire denture with denture adhesive, then either you're using too much and you're not aware of it, or something's not quite right with the denture. that is, you shouldn't really have to use that much adhesive to make it stay in the mouth. If that's the case where that's how much it takes just to have it stay in the mouth, maybe it's time to consider getting a new denture or having your denture relined, which is another thing that can be done to help the denture stay in the mouth better and without nearly as much adhesive. So again, thanks for joining me. Please like and subscribe, and hope you're all staying well and healthy.